Hello everyone, welcome. Today we are going to talk about a very important topic in ECG, which are ECG leads and common rules in ECG production. So, uh, before we go into the further discussions, the basic idea of ECG lead taking or multiple ECG leads are that electrical activity is in heart is such an event that you cannot capture the whole event from a single view. It's like a football game. So in a football game, you need multiple video cameras to get the complete idea. So the complete idea can never be taken from only one view. So multiple ECG leads needed to describe the electrical activity that goes on the heart to get a complete picture or an adequate picture. And that's why we see the electrical activity in heart from 12 leads. So in a typical ECG paper, you have 12 leads, which also can be seen or viewed as a 12 views or 12 angles of seeing the electrical activity in the heart. And there is a common thing, misconception that leads are placed on the body. Actually, leads are not placed on the body. The electrodes are placed on the body, and the leads are generated from those electrodes, or leads are the electrical activity which are taken up from the electrodes placed on the body. And the number of electrodes placed on your body are 9. 3 of those electrodes are placed on your limbs, and 6 of those electrodes are placed on your chest. And ultimate leads that are generated from those electrodes are 12 in number. And those 12 leads can be divided into 6 chest limb leads and 6 chest leads. And the 6 limb leads are lead 1, 2, 3, AVR, AVL, and AVF. They record voltage differences by leads placed on the extremities. So three extremity electrodes creates 6 extremity leads, and those extremity leads can further be divided into 2 groups or 2 subgroups, which are bipolar leads and unipolar leads. Lead 1, 2, and 3 are bipolar leads. Lead AVR, AVL, and AVF are unipolar leads. So here we can see a person with the limb electrodes. So those are the cables, and limb electrodes are placed on all the 4 limbs, but one limb, which is right leg electrode, is not an electrode which measures electrical activity, rather it acts as a neutral point. And other leads actually measure the electrical activity, which are spread outward from heart. So there is right arm electrode, left arm electrode, and left leg electrode. So they measure the electrical activity which is transmitted from the heart to all directions, and we create actually 6 limb leads from those 3 limb electrodes. And among the 6 leads, one group are bipolar leads. So bipolar leads are the first leads to be recorded ever for ECG. So those are the oldest leads, and those leads were discovered by Einthoven, who was actually the inventor of ECG, and he created a triangle using the leads. So he drew a line for those leads, and those lines created a triangle. So here you can see an Einthoven triangle, and this Einthoven triangle shows us that here is the right arm electrode, left arm electrode, and left leg electrode. So those are the electrodes, and the leads generated from those electrodes are lead 1, lead 2, and lead 3. And those leads actually measures the voltage differences between 2 limb electrodes. So lead 1 measures the voltage differences between limb electrode placed on left arm and right arm. Lead 2 measures the voltage differences between limb electrodes placed on left leg and right arm. And lead 3 measures the voltage differences between left leg and left arm. And this triangle can be converted to a triaxial diagram by merging those lines to a central point. So suppose this is the central point, and if we bring those all lines together in the central point, we get a triaxial diagram. So this triaxial diagram has a lead 1 in the center horizontally, and obliquely you have the lead 2 here. So sorry, this will be lead 2, and this is the lead 3 here. Those are triaxial diagram which intersect at a common point. This is another way of viewing the bipolar limb leads. Augmented leads are unipolar leads. So in case of augmented leads, you have the three leads, AVR, AVL, and AVF. They record voltages in a way that in the electrocardiogram, those voltages are augmented about 50% over the actual voltages, and it also done in electrically inside the electrocardiogram. And each lead is represented by an axis with a positive and negative pole. They are called unipolar because the leads record the voltage in one location related to about zero potential in the center of the electrical activity field instead of relative voltages in one other extremity. So that's why the augmented leads are called unipolar leads. So there are three augmented leads or unipolar leads. So this is the central point where the electrical activity is zero, or summation of electrical activity is zero, and lead AVF views the heart cardiac electrical activity from below. Lead AVR sees the electrical activity in the heart from the right hand side, and the AVL from the left hand side. So those are the views for augmented leads. There are 6 chest electrodes placed on your chest. So V1, V2, V3, V4, and V5, and lastly V6. So they record voltage differences by the means of electrodes placed at various positions on the chest wall. So V1 is placed on the right side of the chest from the right side, and V6 to the left side, and others in between. So here you can see a person with electrodes placed on his chest. So this is the V1 electrode, which is placed in the right fourth intercostal space, just close to sternum, and the V2, V3, V4, V5, and V6 placed in a sequence from the left side of the sternum in the fourth intercostal space up to the mid-axillary point. And the views generated from those leads can be seen from this diagram. Suppose this here is the heart, is the cross section, and we are seeing the heart from multiple cameras or multiple views. Like this is a frontal view or anterior view, and this generates a lateral view, and the other leads are in between. So we can see the multiple parts of the heart from multiple different leads. And the chest lead ECG tracing actually vary according to the leads placed on which area. So this may be the lead V1 generating one type of chest lead or one type of electrical tracing in your ECG, and this is the lead V6, which generates shows a different type of electrical activity in the heart. Because this difference occurs because though they are placed in different areas and they represent different areas of heart, because the electrical activity varies between different areas of heart. And the view from the leads can again be seen from this diagram, that the leads placed on the limbs are called frontal plane leads because they see the heart from an above or below view. So the AVR, AVL, right left leads, those sees from heart from above plane or lateral plane, and 2-3 AVF sees the heart from a lower plane. So we see everything in a frontal plane, or we see in a plane which actually measures from above or below. But the horizontal plane leads or the chest lead sees the heart from a horizontal plane, or we see directly into the heart, so from anterior posterior. So we can see the electrical activity in the heart from an anterior posterior view, and the frontal plane leads a superior inferior view. So this is a sample 12 lead ECG showing you all the leads. So first leads are lead 1, 2, 3, which are the limb leads, and the lead bipolar limb leads. So lead 1, 2, 3, and here you can see the augmented leads, lead AVR, AVL, and AVF. Then ultimately you see the chest lead from V1 to V6. And there are some simple ECG rules, and the rule 1 is that a positive deflection appears in any lead if the wave of depolarization in the heart spreads toward that lead or toward the positive pole of that lead. Thus, if the path of atrial stimulation is directed downward and to the patient's left toward the positive pole of lead 2, a positive P wave or upward P wave is seen in lead 2. So toward lead 2, a positive P, because P represents the atrial stimulation or atrial depolarization. Similarly, if the ventricular stimulation path is directed to the left, a positive deflection or R wave is seen in lead 1, because lead 1 is placed in a way that it measures the electrical activity that goes in the leftward direction. And so if electrical activity is directed toward lead 1, it will show a positive deflection. Rule 2 is if a wave of electrical activity goes to the negative pole of that lead or away from the positive pole of that lead, it would show a negative or downward deflection. Thus, if the atrial stimulation path spreads downward to the left, a negative P wave is seen in lead AVR, because the positive pole of lead AVR is actually in above panel. So here you can see in this diagram, suppose this is the RA. So in case of lead 1, or here this diagram in AVR, you can see the AVR. So positive pole of AVR is here and negative pole of AVR is here. So if this is the heart and this is the atrium, and the path of electrical activity is directed downwards, so the electrical activity or depolarization wave is moving away from the positive pole or towards the negative pole, and that's why it would produce a negative P wave in lead AVR. And if we see that electrical activity from AVF, it will produce a positive P wave in lead AVF. And if the ventricular stimulation path is directed entirely away from the positive pole of any lead, a negative QRS complex or QS deflection is seen. And rule 3 tell us that if the mean depolarization is directed at right angles or perpendicular to any lead, a small biphasic deflection consisting of a positive and negative deflection of equal size is seen. Okay, so here you can see the 3 simple basic rules of ECG. So here is a positive pole of a lead and a negative pole of a lead, and if the electrical activity of heart is directed towards the positive pole of a lead, it will show a positive complex or positive deflection or the upward deflection. If the electrical activity is going away from the positive pole of a lead and towards the negative pole of a lead, it will show a negative complex. And if the electrical activity goes right angle to the lead, it will show a biphasic complex. So those are the basics about the ECG leads and its basic ECG rules. I hope they helped you. To get a better idea, you can study the book written by Goldberger. So Goldberger's clinical ECG would be a good resource to see in-depth look of the ECG. So thanks for watching my video and stay tuned for more.